Okay, I think most of the attendees are back, so welcome back. I hope you enjoyed your coffee or tea or whatever you had. So after the first half of the workshop, where we presented in a bit more detail a few aspects Sedenek and his colleagues had raised, like on general issues that are relevant for when it comes to mHealth application implementation. We now focus the second half of the workshop on sharing some good practices, I think, from Spain. This is not by chance, of course. We have considered some feedback from Sedenek and his colleagues of what he and they wanted to hear from us, and therefore we have invited three colleagues from two regions in Spain, the Basque Country and Catalonia, which we are happy to have with us today. And they will present what they have done in terms of developing an mHealth strategy in the Catalan region, and then for the Basque Country, a presentation on the response to professionals' interest in developing mHealth projects. We start with Carme, and now I need to concentrate, Pratdepàdua. That's okay,
right,
Carme.
yes, Pratdepàdua.
Pratdepàdua, okay. From Fundació Tic Salut in Catalan. Carme, it's
Okay,
your floor.
let's share my presentation. Thank you, Sonia, for introducing me. You can see it now, the slides? Yes,
We
right?
can. Thank you. Yes.
Okay, thank you. And thank you and good morning, everyone. And I want to thank the mHealth Hub for organizing this excellent workshop and let us the opportunity to share with you our experiences and lessons learned when implementing mHealth solutions into the Catalan healthcare system. Actually, I'm working in the mHealth area in Tic Salut. Tic Salut is a public agency within the Ministry of Health, and one of the main aims is to foster and promote the implementation and promotion of the innovation in the health system. So before to start going deeper to what we have done in terms of mHealth, it's important to know how is our Catalan healthcare model. Actually, our model is a multi-provider model integrated in a single public network. It means that all healthcare providers are autonomous to manage their center, are free to select their information system. So in this scenario, an interoperability framework, or it's a must, no, to guarantee the correct interoperability among the systems. Some key figures about our region. Currently here, there are 7.5 million people who can be access to the public services. And the life expectancy at birth is around 83 years old, and 80% of the population are over 65 years. So here there are some problems now on aging, and chronicity problems are there. And moreover, in the recent pandemic situation, the use of the current tools has increased a lot and put the transformation of the digital health in the center of all the attentions. When we talk about the health implementations, the Catalan government approved at the beginning of 2015 the first mHealth plan, which tries to, and there were several actions, no, to be undertaken, like, for example, create new technological guidelines to promote, no, the use of this technology in the sector. Also, define an observatory of innovation was needed. Also, create an establishment and accreditation framework for apps, for mHealth apps, to ensure the quality of this data if we want to include it in the system. Also, another topic is create an observatory or a showroom for apps for professionals and for patients to know what kind of apps they can use. And finally, include these mHealth solutions into the different pathways. So here, as most of you know, there are so many issues in the healthcare to be tackled. No, for this reason, one of the first needs was set priorities. And how we set these priorities? we established an executive committee of experts we try to involve, as we mentioned here, most of you mentioned in your presentations, we involve here the main stakeholders of healthcare system at the beginning. Here this executive committee, there is a representative from the healthcare department, also the representative from the main healthcare provider, which is called ICS here in Catalonia. There are members from the public insurance, which is called Tic Salut, among others. This body had the decision power to decide which pathway are to be included in this mConnecta platform that I'm going to talk more deeper later. And how they do this? They decided this criteria like checking the cost benefits aspects or speed of the deployment, and we did it in 2021. One of the first prioritization was monitoring the diabetic patient. For this reason, here in the example of diabetes, Catalonia set up a new relationship model with industry and laid the basis for data integration. It means that we establish a new procurement process that has been designed for procurement of test strips, glucometers, care equipments, medications, in which one of the requirements is having the glucometers associated mobile apps with a qualified certification seal provided by Tic Salut. This is another requirement that it's really important, because fulfilling this requirement, the providers has or gain a better score to the bidders to get the tender. This is one of the first steps that we started to adoption this innovation in the system, and also these providers has to integrate the data standardized in the health system. So in this approach, in this procurement process, are going to participate around 36 kind of medical devices and apps, and the impact, and it will have a very impact, because there are 150,000 diabetic patients that are potential to use the service. So this drives a big change in the way we use and share the information, both in the processes and across the system. When we talk in the implementation of this mHealth solution, we face several challenges. First, we wanted to ensure the quality of this data, define also the relevant data that are going to be integrated and are going to be necessary for professionals, build here a new technological architecture and platform, create obviously an interoperability framework, and help to industry to be prepared. The first challenges in terms of ensuring the quality and reliability of the data, I don't want to go deeper in the assessment framework, but here it's I think it's important to take into account that as the criteria of this assessment framework is periodically reviewed and has to be adapted to the current regulations, like Petra has presented, the current ISO. We have to work on that. Also, one lesson learned from that is that it's important to create a committee of experts. Actually, we have it. One of them is expert in this committee. There are professionals that healthcare professionals, nurses, doctors that are involved in assess this kind of apps, particularly in the clinical evidence or content and functionality. So also this committee are professionals that develop this work offsite their working life. So keep them motivated and committed. It's an important and a crucial task, to develop this assessment. It's something to take into account. Another issue here we learned is when and how to include the relevant data. In this context, there was establishing some steps. The first, established a multidisciplinary working group in the case of the pathway for diabetes, which there are several professionals involved from all the healthcare processes, no? From primary care, specialized care, endocrinologists, pediatrics, etc. And another step is define processes change request in the sense of identifying the added value that the innovation brings to the particular process, in the case of diabetes, no, for example. And the third step is identify the relevant data. It's important here to identify relevant data, not all the data that the device can bring us. We here specifically select the specific data that the professional will or the data that is important for professional to follow up the patient during the illness, no? And finally, this data has to be standardized and has to follow the standard in clinical terminology like SNOMED CT, and this is really, really necessary. Here, another challenge, no, is create the technology, the architecture, no, the mConnecta platform. Obviously, mConnecta platform it's a platform that it's needed because need the integration or let the integration of the data into the health system, into the electronic health record of the patient. And one of the added value of this platform is that the professional can check the data generated regardless of the device the data comes from. It means the professional does need to connect to different internet platforms to check the patient's information. And another added value is that professional can prescribe a mobility solution to their patient, and all the prescriptions are stored in the system in a formal way, not as informal as maybe they usually do in the working life. No. The pathway, for example, from diabetes, it could be here as an example. First, in the the mobile ads are included in the process. The healthcare professional can prescribe it to the patient in the first visit. The patient can download the app, can start generating data, and the professional can check this data in real time. And finally, maybe in the second visit on the other's visit, a professional can select this relevant data to be included in the PHR of the patient. In terms of interoperability, obviously interoperability it's a must, no? And here we have a terminology server where the variables that has to be included in this server and are follow the standards like SNOMED CT, LOING, etc. This is interoperability like in both sides, syntactic and semantic. It means that also the messaging has to be codified using HL7 FHIR and this kind of standards. And this is also really important. I don't want to go deeper on that part. And another issue, and finally, for these lessons learned, is that you don't have to forget to help the industry to be prepared. In order, we try to provide this kind of information, tools, and support in order to help them to codify, for example, these variables, to help them to define these messaging standards using FHIR. Also, all the criteria for the apps assessment is published in our website, and this is also useful for them. And in the other side, in the side of the data of GPDR, also we create a tool that helps to industry to validate or to assess the impact of the ICT provided solutions. So here is an example of what we did here in our region in Catalonia. And obviously the pandemic situation has delayed some issues, and for example the release of this procurement process from diabetes, but we'll see in the next month. So here is my presentation. I leave you here my email and you can contact me for whatever. Thank you.
Thank you very much, Carme, for again a clear presentation. I think it's always great to learn from those who have undergone the process already to some extent at least. That helps always a lot. So I open the floor for questions, and I see someone raise the hand. Mark, go ahead, please, Mark.
Thank you, Sonia, and thank you, Carme, for this very clear presentation and also compact. Very great.
Yes.
Can I just, having in mind the Czech Republic requirements and plans, do I understand right that in your presentation, where you are presenting the diabetes app and the process that you launched to develop the diabetes app, here you are working as a client, asking, or as a healthcare system asking for developing an app. So meaning that this is. I would see this different from creating mConnecta, from defining the interoperability framework and providing the industry with some guidance, because that's, I would say, typically the role of a public authority to create a framework to develop mHealth Hub. So the diabetes development, it's something that is slightly different from the development of the infrastructure. Did I got it right?
Yes, right. It's different. One side is the mConnecta platform, which is mConnecta platform. It's in a big way, no? Because mConnecta led the opportunity to integrate this mobility data that is generated outside and can be included in the health system. But in the case of diabetes, is for example, in the case of reimbursement for apps, no, it's something that appear here. In the case of diabetes, is we try to adapt this procurement process, because for the acquisition or the procurement of test strips, glucometers, these kind of things, the healthcare system has to, or the healthcare provider has to do a procurement process. And one of the first actions is to include in this procurement these kind of requirements to ask for the providers to comply this for example, for apps, to this mHealth assessment framework, no? And also in the other side, these healthcare providers will include the data standardizing the system. So this is one of the first steps to start including in this procurement process, not only for diabetes but also from another healthcare processes, these requirements in the tender. This is different things, but obviously the infrastructure is mConnecta, which is the platform who will help on that.
Thank you. Thank you.
You're welcome.
Any further questions? Yeah, sorry.
Yeah,
go ahead.
Thank you for a nice presentation, and it provokes a lot of questions. Maybe the first is, what is the experience on the process? Because this is a sort of maybe I perceive it as an experiment, to design everything on the level of the healthcare authority, and then to gradually implement it into the practice. So what is your experience? How long it would take? How long it take, and how long, or how much resources needed for that? And maybe do you want to replicate this for other diseases like COPD or maybe other? So what you can say about this? Because this is for us to consider. We still don't have such kind of infrastructure and resource and capabilities to design everything from the beginning, the owning platform and all these things. This is something which looks like lots of effort to be done, and therefore, what's your experience with it? Whether it was good with the decision, and whether you try to replicate this in the future?
Here actually in Catalonia at the beginning, or so many years ago, all the healthcare, the healthcare department are interested, in to foster and to promote this health into the system. So they did a big investment on that, in terms of creating this mConnecta platform. and now the platform is finalized, no, and Tic Salut has implemented that, has created that, and now the government is really interested because they adopted the platform, and the mission now, the mission of the government is to start to deploy the platform across the country, no. So I think it's good experiences. Obviously, there are so many issues and so many things to take into account in all that process because it's not easy. At the beginning, 2017, we did a pilot stage with this platform, a previously one, no, that was called Tic Salut, and the pilot was really good, and for this reason we improve the platform and start doing this second phase of the project. So I think, as most of you tell in your presentations, include an important, the main stakeholders at the beginning. It's really crucial because sometimes here in the case of Catalonia, there are, as I mentioned, there are different healthcare providers. There are different information systems. Also, there are the Catalan department, there are the provider of the main healthcare provider. Also, there are the insurance who pay from the services. A lot of stakeholders there, and to get a commitment of everyone, it's really difficult. So a lot of meetings there, and it's depending on the country, obviously. Maybe in Andalusian community, they has only maybe one single healthcare system, and maybe would easy this part, but obviously in the other part we've had some problems. So I think this is the thing.
Thank you. Great. And what is now the practice, particularly whether the MDs, the doctors, whether they like to prescribe it, or whether you see some reluctance with this new approach to healthcare?
In the working groups, for example, from diabetes, they are really interesting in the relevant data. Not all the data that all the devices can be provided, because this is also the problem, because there are different devices. All the devices are generating a lot of data. So in the working groups, they tell us that specific relevant data are important for them, not all the data, and they wanted to have all the data integrated in their working in their information system, in their workstation. So this is after the pilot in 2017. They feel really great because they can prescribe an app to a patient. But obviously there appear some problems like the like literacy, no, or this kind of problems that also in Fundación we have another project that we started about how to check, no, the digital competencies from professionals and patients. So this is both sides, no, because in one side professionals wants to know the ICT skills of the patient who are going to prescribe the app, and this is something to take into account. On the other side, the professionals don't have the same abilities, so using this mHealth solution. So in the pilot stage, we spend a lot of time with the professionals, helping them to show how the apps works, no? And it's something that at the beginning you don't think on that. You don't think that, oh, no, as my point of view, an app, it's easy for me use an app, but for depending on the person, it's not the same. So this is something that, well, this is the practice, no?
Yeah, I guess it's part of the normal process. Yes, Carme.
Yeah.
Any further questions to Carme?
Well, could I just have a question, Bore from Ministry of Health, about the motivation? You know, how do you motivate the citizens to use that?
I think citizens, I think this is not a problem because they actually it's a pool, no? They use the technology nowadays. I think the problem maybe is motivate professionals, healthcare professionals, to realize that that using this kind of tools helps them in their life. And in the pilot, for example, it's something that appeared that so. As my point of view,
I understand. Thank you. That's what I expect.
I would imagine that the two relate sometimes, probably. I mean, if there are professionals that are recommending apps, and that's I think one of the crucial points that motivates also patients to use their apps. At least in Germany, I mean, many people are really trusting their GPs in whatever they, I think I can phrase it like that, whatever they say, and if they recommend a specific app, I guess that would motivate the patients to use that app quite a lot. That would be my feeling, at least for the German population. Maybe that's different in other countries.
Totally.
But if I can, Sonia, and
Sure.
having in mind the example of Belgium, for prescribing medications, doctors first have been at school and have learned what are the medications that are worthwhile to be prescribed. And second, they are, at least in Belgium, regularly visited by sales representatives of the pharma companies to promote, update new version of their medication.
Yes.
This is, of course, something that doesn't happen yet in the mHealth industry. So that's clear that there is a big gap here, and I do remember having read an article and having also welcomed someone from Orca in our symposium, where they were making the point that the medication infrastructure, the organization that is in place for managing medications, is not at all yet in place for managing and promoting the digital health industry. So that's still a long way to go on this. Thank you.
Yeah, thank you, Mark. Eugenie, maybe I'm not pronouncing this correctly, from Tic Salut, I'm sorry.
Okay, so interesting, because the point of view is that, sorry, the people from the IT sector goes to the hospitals but doesn't speak with the medical staff. They speak with the IT staff, and that's a stopper, because they think they have to present his products to the IT staff, and that's the wrong view. They have to present his product to the health people, which is we'll adopt that solution in the last place. Okay, that's a problem of communication, and here we have a very big work to do to make the culture of, you have a health product to give us. This is not a product of IT. This is a health product. Then the doctor and the nurse is your public, or the final people, which is the patient. IT is a vehicle.
Yeah, but you have to find out the proper stakeholder in the doctors.
Yeah, and that view. Yeah, I know, because you have, at the other side, you have the problem, because the IT skills of the medical staff, it's a problem too, it's a stopper too, because they don't understand, but it's a team. But the main last user is the health user, not the IT. The IT is a vehicle, and they have to bring and to put every tools to make it easy. But it's not an IT product as a computer or other stuff. That's all.
Yeah.
I think, Vanessa, you wanted to jump in here. Just to introduce you, Vanessa is an external expert from the mHealth Hub, invited based on her excellent expertise on health technology assessment, which is one of the focus points for the colleagues in the Czech Republic. And she's working as an impact manager for R&D projects at the Automation and Systems Laboratory at the Instituto Pedro Nunes in Coimbra in Portugal. Vanessa, go ahead.
Hi, nice to meet you all. First of all, thank you for the invitation. It was really interesting. I just want to jump in because one of the things that I find amazed about the apps is like every day more than 200 apps are released. So I think it's really not able to the doctors to be up to date to these kind of apps. And for me, one of the things that is also really dangerous is the fact there is no validation on these apps. So they release and they expect the doctors use it or the citizens use it and so on. And for you to have an idea, a recent study showed that in 300 apps for diabetes, only 5 were like with clinical meaningful impact. So for me, I think one of the things that is really important is also to involve the healthcare professionals to help to validate the value of these apps. So not only to sell the product, but also when we are building the product. So as Sonia was saying, I'm like involved in the health technology assessment, and in Europe we have that really well established for medication and for pharma, but for medical devices and especially for mobile applications, that is not yet really well standardized. So I think it's really important all the work that you have been doing, and I think it has to be also kind of agreement between European Union to establish the minimum of efficacy that apps should show. And also, for me, in my point of view, all the stakeholders should be involved in the early stage of the development of the app, not only like the IT guys or these, because if we involve the clinicians sooner, they will understand the value, and probably they will also suggest some features that the IT guys didn't remember about it. So I think it's really important to have these in mind when we are developing some product, and also when we are testing, like the outcomes that we measure to be able to produce some value for the society, for the clinicians, and for the users as well. Thank you.
Thank you, Vanessa. I mean, that's, I think, exactly why the work of the mHealth Hub on the assessment framework works that are existing, and also the work Petra and her team are doing on providing an assessment framework and a label actually for those applications is so important. Not an easy task though. Any further questions in relation to what Carme presented or what has been discussed after that presentation? Okay, I'm having some connection issues. Was there someone who raised the hand or so? No. Okay, good. Then we go to the next.
Sonia, you're muted.
Sorry. Sometimes you click twice and then it's too slow. Sorry. So we go ahead with presenting another example. We have invited, presented by our colleagues from Conigune in the Basque Country. So Dolores and your colleague, please introduce yourself and then take the floor. Thank you very much.
Thank you very much, Sonja. Thank you very much to the mHealth Hub for preparing and arranging this workshop, and